The number one exercise to lower your blood pressure. And this one has beaten cardio, resistance training, HIIT, and every other category of movement out there. Not in some tiny study, not in some lab experiment with 12 people, but in 270 different randomized controlled trials that involved just under 16,000 human participants, and the winner was an exercise that requires zero movement whatsoever. You don't need a gym, you don't need a treadmill, you don't even need to leave your living room. All you need is the wall right behind you as you're watching this video. The exercise that beat every other modality for lowering systolic blood pressure, that's the top number, was a movement called the wall sit, sometimes called the wall squat. This is a type of training called isometric exercise. That means you are not moving, but you are actively contracting your muscles hard, holding them under load, and they are doing real physiological work. I'm going to explain this thoroughly because virtually every single person watching this video can actually perform this exercise, regardless of age, regardless of your current fitness level, regardless of whether you have worked out in years. But to be honest with you, this isn't a sexy exercise. There is no dramatic motion. Nobody is going to film themselves doing a wall sit and post it on social media for likes. And because of that, it has been completely underneath the clinical radar for decades. Most personal trainers have never prescribed it. Most physicians have never even heard of it, and that, in my professional opinion as Dr. David, is a quiet tragedy, because what we are talking about here has the potential to prevent millions of heart attacks and millions of strokes every single year if it were ever adopted at scale. Before I get into the protocol, I want to give you some context. What really shocked me when I started digging into this research in depth was just how widespread the problem actually is. Over 50% of the adults in the United States right now have blood pressure readings that put them into the hypertensive category. And the most terrifying part of that statistic is not the size of the group, it's this: most of them don't even know they have it. High blood pressure has absolutely earned its nickname, the silent killer, because most of the time, you do not feel it. You do not feel your blood vessels slowly tightening over the years. You do not feel the micro damage being done to the inner lining of your arteries with every passing heartbeat. You do not feel your heart having to push harder and harder against that rising resistance. You just go about your normal day feeling completely fine while, silently, your risk of heart attack, stroke, kidney failure, vascular dementia, and sudden cardiac death keeps climbing higher and higher. Now here is the part that really frustrates me as a clinician. Isometric exercises for blood pressure are completely beneath the clinical radar. They are not really being recommended in standard practice. They are not really being recommended by primary care physicians. They are not really being recommended by most cardiologists. And there is a historical reason for that, and it is going to shock you. When researchers first studied isometric exercise way back in the day, they measured something simple, and they stopped. While you are actively clenching a muscle, your blood pressure spikes. That's it. They said, "This is dangerous. We are not going to recommend this. We are going to actively tell patients with hypertension not to do isometric exercises because it is going to make their numbers worse." And that conclusion, that single half-baked observation, filtered all the way through international scientific committees. It made its way into medical guidelines, it made its way into cardiology textbooks, and it made its way into the clinical instincts of an entire generation of doctors around the world, all based on initial observations, not based on long-term follow-up research with real outcome data, not based on controlled randomized trials. Just one quick measurement that said, hey, blood pressure goes up while you are doing the exercise, and that single assumption has dominated clinical practice for the last 40 to 50 years. And here is the deeper problem that rarely gets talked about. A tremendous amount of the early research in the area of exercise and blood pressure involves observational studies, which frankly are not nearly as credible. That is basically where researchers don't actually test anything. They don't randomize anyone into an exercise group. They don't control variables. They don't give anyone an intervention. They just observe what people already do on their own in their free time, and then they associate that behavior with some later health outcome. But an association is not proof, it is just a guess. Correlation does not equal causation, and that is exactly what happened with isometric exercise. People made a guess based on the temporary spike that they measured in the moment, and they never followed the participants long enough to see what happened after the contraction was released. Then, when they finally did the proper research, when they actually randomized people, when they actually followed them over weeks and months with continuous monitoring, they discovered something remarkable. That spike in blood pressure during the isometric exercise was extremely temporary. It lasted only as long as the contraction, and once the contraction was released, something completely unexpected was happening inside the blood vessel walls, something profoundly beneficial, a recovery response greater than anyone had anticipated. In 2023, the British Journal of Sports Medicine published a landmark systematic review and network meta-analysis by Edwards and colleagues. Researchers there pulled together 270 randomized controlled trials from across the world, spanning decades of work and dozens of countries. They got just under 16,000 participants involved in the pooled analysis. That is one of the largest and most comprehensive analyses ever conducted on exercise and resting blood pressure, and what they found is going to fundamentally change how we think about exercise for hypertension. This is directly relating to bringing down systolic blood pressure. That's the top number, the one that matters most as we age. Listen to these numbers carefully. Combination training, where you mix aerobic and resistance work together in the same workout, brought the systolic pressure down by just over 6 points. Dynamic resistance training alone, your classic weightlifting sets and reps, brought it down by roughly 4.5 points. Aerobic exercise training, the old reliable that everyone has been told to do for 30 years, brought it down by about 4.5 points. High-intensity interval training, the popular HIIT workouts you see all over the internet right now, brought it down by about 4 points. But check this out, isometric exercise training, and specifically the wall sit, brought systolic blood pressure down by more than 8 full points. That was the single biggest drop of any exercise category in the entire 270 trial analysis. And in the secondary network ranking, the wall squat scored a 90.4% probability of being the best submode for reducing systolic blood pressure, the highest of anything tested. They also identified other forms of isometric training, like the plank and the isometric hand grip, that were not quite as dramatic as the wall sit, but were still better than cardio, better than HIIT, better than resistance training alone, when it came to lowering systolic pressure specifically. Quite fascinating, when you really sit with that for a moment. And I do want to point something out, because I don't want to mislead anyone watching this. If your diastolic blood pressure is the one that runs high, that's the bottom number, the one that represents the pressure inside your arteries when your heart is at rest between beats, then aerobic cardio actually beat the wall sit for that specific outcome. So if your main issue is diastolic, you may specifically want to combine the wall sit with regular cardio to address both numbers. But statistically speaking, most people with hypertension, especially as they get older and their arteries stiffen, have a much bigger problem with the systolic number, the top number, that is the one most influenced by arterial stiffness and aging. So for the majority of the audience watching this, the wall sit is going to be a very direct, very targeted intervention for the number that matters most. I want to be completely clear about something. I am not against any of these forms of exercise. In fact, I do all of them myself. I do my cardio, I do my strength training, I do my HIIT sessions. What I am telling you is that you should also include this one extra, this wall sit, if you want a more specific and more dramatic reduction in systolic blood pressure than any other single modality on its own can give you. Now let me show you why this drop of 8 points matters so much in real-world outcomes. There was a massive meta-analysis published in The Lancet by Edebad and colleagues. It looked at 123 different randomized clinical trials and involved over 613,000 people across multiple continents and populations, and what they found was life-changing. When you lower systolic blood pressure by just 10 points, major cardiovascular events drop by 20%. Coronary heart disease goes down by 17%, stroke goes down by 27%, heart failure goes down by 28%, and death from all causes goes down by 13%. That is not a small change, that is a massive change, from just a 10-point drop in that top number. And so when I tell you that the wall sit brings blood pressure down by 8 points, you are getting most of the cardiovascular benefit from that 10-point drop. You are getting most of that protection from one single exercise, from about 24 minutes a week. I have a free download that I want to give you. It is a daily routine checklist. This is the exact routine I use every single day to feel younger, stronger, and more energetic than I did 20 years ago, and I want to give it to you for free. There is a little link right down below in the description. Just click it, download it, and start using it today. It has saved my patients years of trial and error, and it will save yours too. Now I want to mention one additional thing that really puts all of this in perspective for you. There are a lot of randomized controlled drug studies on blood pressure medications that have been published over the last few decades. And a lot of them, when you look at them individually, show a decrease in systolic blood pressure right around 8 points. That is roughly the average effect of a single first-line blood pressure medication prescribed on its own. So this isometric exercise, the wall sit, is comparable to a single drug effect, comparable to a single prescription pill, without the side effects, without the monthly cost, without the dependency, without the interactions with other medications. And yet doctors, by and large, are still not recommending this in their offices. Right now, mainstream consensus, mainstream cardiology, mainstream internal medicine is about 10 to 15 years behind what is actually happening in the peer-reviewed research literature. And that gap, that lag in translation from research to bedside, is costing people their lives every single day. And statistically meaningful drops in resting blood pressure have been documented after as little as 4 to 6 weeks of consistent wall-sit training, 3 sessions per week. Now, the next thing I want to talk about, and this is honestly the part that I find most fascinating. How can an exercise that involves zero movement lower your blood pressure? Think about it for a second. You are sitting still, you are pressing your back flat against the wall, your knees are bent. Your blood pressure is actually going up locally in your legs while you are contracting. How on earth, physiologically, is that going to lower your overall systemic blood pressure once you stand up and walk away? Here is exactly what is happening on a mechanical and biochemical level. When you contract those muscles, specifically the large muscles of your thighs and your glutes, you are creating a sustained, intense isometric contraction. That contraction is squeezing down hard on the blood vessels running through those muscles. It is physically restricting blood flow. Imagine you have a garden hose and you put a sharp kink in it. The water cannot pass through freely anymore. That is exactly what is happening inside your legs during a wall sit. Blood flow is being temporarily choked off inside millions of tiny capillaries and larger vessels. Then, when you stand up and release the contraction, the kink in the hose disappears. Blood flow comes rushing back in with real velocity. It comes back fast. And as it rushes back through those blood vessels, it pushes forcefully against the inner lining of the vessel wall, a thin cellular layer called the endothelial lining. That sudden shear stress on the endothelial lining turns on a specific biochemical signaling cascade. It spikes something called nitric oxide. Nitric oxide is one of the most powerful vasodilators that your body produces naturally. It actively relaxes the smooth muscle wrapped around your blood vessels. All that resistance through your arteries drops. Your blood vessels widen, your blood pressure comes down. That is the mechanism. It is elegant, it is reproducible. And it has now been confirmed in 270 randomized controlled trials across 16,000 people. Now here is the protocol, the exact prescription I recommend to my patients, and that I use myself every week. You are going to do 4 wall sits in a row. Each one is going to last for 2 full minutes. Between each wall sit, you rest for 2 minutes. You do this entire sequence 3 times a week. That's it. That is the whole prescription. Just 24 minutes a week of total exercise time. Most people spend more time than that, scrolling through their phone in a single sitting. 24 minutes a week, and you are getting an 8-point drop in systolic blood pressure, which is comparable to what a single prescription medication achieves. What is happening over a period of weeks and months is even more powerful than that single acute drop after each session. You are slowly remodeling your arteries from the inside out. The endothelial lining becomes healthier, more responsive, and more capable of producing nitric oxide on demand. You are also retraining your autonomic nervous system, the part of your nervous system that is controlling the tone and tension of those blood vessels 24 hours a day, every minute, every heartbeat. The balance between your sympathetic branch, the fight or flight accelerator, and your parasympathetic branch, the rest and digest brake, shifts gradually. You become more relaxed at rest. Your vessels hold less baseline tension, and so the effect compounds over time. The longer you stick with it, the better the result you get. The effect is not just acute, it is structural. The reason the wall sit specifically is the best choice out of all the isometric exercises, beating planks, beating hand grip, beating leg extensions and curls, is that you are working the largest muscle groups of your entire body. Your thigh muscles, your quadriceps, your hamstrings, and your glute muscles, these are massive muscle groups that demand massive blood flow. The bigger the muscle you are recruiting, the more blood flow restriction you create during the contraction, the bigger the kink in the hose. The bigger the subsequent shear stress on the endothelium when you release, the bigger the nitric oxide spike, the bigger the drop in blood pressure, so muscle size really matters here. That is exactly why the wall sit wins this comparison. Now, I do want to briefly address a common question I get from viewers all the time. People ask me, what supplements do I recommend to support healthy blood pressure? Now, I am not here to sell you anything in this video, but there are a handful of foundational nutrients that have solid peer-reviewed research behind them for blood pressure support. Magnesium, potassium, omega-3 fatty acids, and CoQ10 are all worth researching on your own. If you want to look into a high-quality supplement brand that covers these essentials, I have a list of the ones I personally trust and the reasoning behind each one in the description down below. As always, talk to your own doctor before starting anything new, especially if you are already on a blood pressure medication, because some supplements can interact with prescription drugs and you want to be safe. Now, the single biggest reason why people quit this exercise, and I want to warn you about this in advance so you do not fall into the trap, is because the wall sit is actually quite difficult, especially for beginners and for anyone with deconditioned legs. Most people try to do it at a 90-degree angle right out of the gate, and their legs start shaking within 30 seconds, their thighs are on fire, they cannot tolerate it, they give up, they never come back to it. Please do not be that person. The key variable here is the knee angle, and the angle determines your intensity. Here is exactly how to start. If you are a complete beginner, you are going to begin at a 135-degree knee angle, that is almost with your knees fully extended out straight, you are just barely bending the knees. You are going to hold that gentle bend for 2 full minutes. After you can tolerate that comfortably, 2 minutes without too much struggle and without too much shaking, you drop down 10 degrees lower. So you are now at 125 degrees, you hold that for 2 minutes. When you can comfortably hold 125 degrees, you drop down to 115. You continue this gradual progression. Every week or two, you are going to lower the angle by another 10 degrees until you can balance the difficulty of doing the exercise with the intensity. So it is not too intense that you fail halfway through. It is not too easy that you are wasting your time. You are right in that sweet spot of productive challenge. And the long-term goal, over the course of weeks or months depending on your starting fitness level, is to work your way down to a 90-degree angle, which is the classic textbook wall sit that you have seen in fitness magazines. What determines the right intensity for you, the level you should be working at? You should be able to hold a normal conversation while doing the exercise. You are not straining your voice, your legs are not shaking uncontrollably, you are not making weird faces or gritting your teeth. You want to feel like you are in control of the exercise, not like the exercise is in control of you. You want your breathing to be steady and calm, and this next point is absolutely critical. Do not hold your breath. You are going to slowly breathe in through your nose, and slowly breathe out through your nose the entire time. Slow, controlled nasal breathing. Holding your breath during isometric exercise is called the Valsalva maneuver, and it can spike your blood pressure dramatically during the exercise, which is the exact opposite of what we are trying to do here. The whole point is to train that window of contraction safely so the release response is therapeutic. So remember, breathe, always keep breathing, slow nasal breaths in, slow nasal breaths out. I also want to make sure that anyone with really bad knees still has a viable option. If your knees are severely arthritic, if surgery is on the table, or if bending them at all causes sharp pain, you can still get most of the benefit from isometric hand grip training. There are inexpensive hand grip devices you can buy online for just a few dollars. You squeeze one firmly and hold the squeeze for 2 full minutes, then rest for 2 minutes, repeat 4 times, and do that whole sequence 3 times a week. The physiological mechanism is exactly the same as the wall sit, just on a smaller scale with smaller muscle groups, sustained contraction, restricted blood flow, nitric oxide release on release, vasodilation. It will not give you quite the same dramatic drop as the wall sit, since the forearm muscles are smaller than the glutes and thighs, but it is still a very meaningful drop, and for someone with bad knees who cannot physically tolerate a wall sit, it is an absolute game changer. I'll put a link down below to a separate video I have explaining exactly how to do the hand grip version with proper technique. I also want to strongly recommend that you get a quality at-home blood pressure cuff to monitor your own numbers, not just at the doctor's office once a year. At home, take your blood pressure right before you do the wall sit. take it again immediately after, take it again 30 minutes after, and take it again 2 hours after. Get to know your own personal response curve. Some people see their biggest drop 30 minutes after the exercise. Some people see the biggest drop 2 hours after. Some people see the biggest effect the next morning. Everyone responds slightly differently, and you want to understand what your own body is doing so you can refine the timing of your sessions and know with real data whether or not this is working for you. Now, this is honestly a great technique, and I genuinely believe it could help a lot of people lower their numbers naturally and reduce their dependency on medication over time under their doctor's supervision. But I want to be straight with you. The wall sit is not the complete answer. The wall sit addresses one specific mechanism, the mechanical vascular mechanism that helps your blood vessels relax and stay relaxed. But what is really at the root of high blood pressure in the first place? Why do over 50% of adults in this country have it? Why are insulin resistance, cortisol dysregulation, chronic low-grade inflammation, mineral deficiencies, poor sleep architecture, and chronic dehydration all pushing those numbers up year after year in the first place? That is the deeper question. And honestly, until you address the root cause of why your blood pressure is elevated in the first place, you are going to be playing whack-a-mole with your numbers for the rest of your life. You will manage them, but you will never truly resolve them. For that information, for the actual root cause story most doctors never talk about, you need to watch this video right here. Click it, watch it. It will completely change how you think about high blood pressure and what is actually driving it in modern life. I'll see you in the next one.